I would like to talk about the epidemic first and foremost. That's why Professor Sophia Chan, Secretary for Food and Health, is here with me. Now, I would like to talk about a community cluster of infection cases. This cluster so far involves 9 confirmed cases, possibly. I have to stress it's possibly because all the investigation is still being carried out. For the 9 confirmed cases, the first one was confirmed and who is unfortunately still in a critical condition. That's the lady, and then her husband. Now, usually in such infection cases, it's about close contact of family members. So the first 2 in the cluster. And then there are 2 colleagues working in the same warehouse as the first patient. But of course, we don't know yet who were the first to be infected. We still have to find out. But then, anyway, there are 2 other colleagues working in the warehouse. And so this is infection at the workplace. And then last night at the building where the lady lives, that is Luk Chun House of the Lik Chun Estate, so far we have done over 1,000 tests, and 4 residents in the building have been confirmed or tested positive. Now, Professor Yin Kwok Yong and our colleagues visited the building. The initial conclusion that it's not to do with the building structure that's led to the risk is possible. So therefore, there is environmental contamination and infection as a result. And then the 4th patient is colleague of the Fire Services Department. Now, he sent the first patient to the hospital. It's suspected that he could have gotten infected. So it's the first time that we have a healthcare worker who is infected at work, because for the other earlier case, it's not yet confirmed whether that colleague was infected at the airport, and she's from the Department of Health. So we are highly concerned about this case. It's not just because of the number. As I said, so far for this cluster, there are 9 confirmed cases, but rather in this cluster, there are various elements that are cause of concern. For example, the workplace element and possible infection for people going in and out of a building. So that's why we're carrying out a series of investigation